Question 1. The evaluation methodology shows a 4-year-old child with cerebral palsy exhibiting significant challenges with trunk dissociation and reciprocal leg movements during the functional task of walking to retrieve a toy. When applying the NDT approach to improve postural control and movement patterns for this functional skill, which of the following implementation strategies best reflects a balanced and effective application of NDT principles? Option A. The therapist provides gentle, dynamic handling to facilitate trunk dissociation and support the child's weight shift, while simultaneously offering opportunities for the child to actively attempt reciprocal leg movements and problem solve during the walking task. Option B. The therapist uses a variety of assistive devices to ensure the child can walk the entire distance to the toy, with the primary goal being task completion rather than addressing underlying postural control or movement pattern deficits. Option C. The therapist focuses on breaking down the walking task into smaller components and practicing each component with external support, without specific attention to facilitating trunk dissociation or reciprocal leg patterns through handling. Option D. The therapist primarily uses sustained manual facilitation to stabilize the child's pelvis and guide reciprocal leg movements, with minimal verbal cueing or opportunities for the child to initiate movement independently during the walking task. Correct answer is D. The therapist primarily uses sustained manual facilitation to stabilize the child's pelvis and guide reciprocal leg movements, with minimal verbal cueing or opportunities for the child to initiate movement independently during the walking task. Explanation. This scenario presents a common implementation challenge for a certified clinical specialist in pediatric physical therapy, PCS, applying the neurodevelopmental treatment, NDT, approach. The challenge lies in balancing the theoretical underpinnings of NDT, which emphasize facilitating optimal movement patterns and postural control through therapist handling, with the practical realities of a child's engagement and the need to foster active participation and functional skill development. The therapist must consider how to integrate NDT principles without inadvertently creating a passive experience for the child or neglecting the child's intrinsic motivation and the demands of the functional task. The correct approach involves a dynamic integration of NDT handling techniques to facilitate improved postural alignment and movement quality, while simultaneously providing opportunities for the child to actively engage in the functional task. This approach recognizes that NDT is not solely about passive facilitation, but about enabling the child to experience more organized movement that can then be applied to functional activities. The therapist's role is to use their hands to guide and support the child's attempts, making the movement more successful and rewarding, thereby promoting motor learning and generalization. This aligns with the ethical responsibility to provide evidence-based care that maximizes a child's functional potential and promotes active participation, as guided by the principles of patient-centered care and the APTA Code of Ethics, which emphasizes providing competent care and respecting patient autonomy. An incorrect approach would be to solely focus on the therapist's manual facilitation of postural control and movement patterns without actively involving the child in the functional task. This could lead to the child becoming a passive recipient of treatment, hindering the development of active problem-solving and self-initiation of movement, which are crucial for long-term functional gains. This approach fails to adequately address the functional skill development aspect of NDT and may not promote the child's active engagement, potentially violating the ethical principle of promoting patient autonomy and participation. Another incorrect approach would be to prioritize the functional task completion at the expense of addressing underlying postural control and movement pattern deficits. While functional outcomes are paramount, neglecting the foundational elements that impede efficient and organized movement can lead to compensatory strategies, increased effort, and ultimately, less sustainable functional abilities. This approach might overlook the core tenets of NDT, which aim to improve the quality of movement, and could be seen as a failure to provide comprehensive and specialized care expected of a PCS. A third incorrect approach would be to rigidly adhere to a specific NDT handling technique without adapting it to the child's current abilities and the specific demands of the functional task. NDT is a problem-solving approach. An effective application requires continuous assessment and modification of handling based on the child's responses. A lack of flexibility and responsiveness to the child's cues can result in ineffective treatment, and a missed opportunity to facilitate optimal movement. This represents a failure in clinical reasoning and the application of specialized knowledge, which is a cornerstone of advanced practice and ethical professional conduct. The professional decision-making process for similar situations should involve a thorough assessment of the child's postural control, movement patterns, and functional limitations. Therapists should then consider how NDT principles can be applied to facilitate more organized movement that directly supports the targeted functional skill. This requires a dynamic interplay between therapist-led facilitation and child-led exploration and practice within the context of the functional activity. The therapist must continuously evaluate the child's response to handling and adjust their intervention to promote active participation, motor learning, and the achievement of functional goals, always prioritizing the child's engagement and the development of self-efficacy. Question 2. Cost-benefit analysis shows that a pediatric physical therapist specializing in pediatric physical therapy must consider the most effective and efficient methods for addressing a child's functional limitations. When evaluating a 7-year-old child presenting with difficulties in motor planning, sequencing tasks, and maintaining attention during therapy sessions, which of the following approaches best reflects an integrated understanding of cognitive development relevant to pediatric physical therapy practice? Option A. Prioritizing interventions that directly target gross motor skills, assuming cognitive improvements will naturally follow improved motor performance. Option B. Implementing a standardized motor skills program without specific consideration for the child's individual cognitive strengths and weaknesses, relying on general developmental norms. Option C. Focusing exclusively on Piaget's pre-operational stage characteristics to explain the child's current challenges, despite the child's age. Option D. Conducting a comprehensive assessment that considers the child's performance across Piaget stages, information processing abilities, e.g., attention, memory, processing speed, and executive functions, e.g., planning, inhibition, working memory, to inform intervention selection. The correct answer is A. Prioritizing interventions that directly target gross motor skills, assuming cognitive improvements will naturally follow improved motor performance. Explanation. This scenario is professionally challenging because it requires a pediatric physical therapist to integrate complex theoretical frameworks of cognitive development with practical clinical decision-making, all while adhering to the specific regulatory and ethical standards governing the Certified Clinical Specialist in Pediatric Physical Therapy, PCS, credential. The challenge lies in accurately assessing a child's cognitive abilities within the context of their motor development, and then tailoring interventions that are both developmentally appropriate and evidence-based, ensuring that the chosen approach aligns with the scope of practice and ethical obligations. The correct approach involves a comprehensive assessment that considers the child's performance across Piaget stages, information processing capabilities, and executive functions, and then uses this understanding to inform the selection of therapeutic strategies. This aligns with the PCS credential's emphasis on advanced knowledge and clinical reasoning in pediatric physical therapy. Regulatory and ethical justification stems from the principle of providing individualized, evidence-based care that respects the child's developmental trajectory and maximizes their functional potential. This approach is supported by the ethical guidelines that mandate competence, professional judgment, and the pursuit of optimal outcomes for pediatric patients. An incorrect approach that focuses solely on observable motor deficits without considering the underlying cognitive processes would be ethically and regulatorily flawed. This failure would stem from a lack of comprehensive assessment, potentially leading to ineffective or inappropriate interventions. It would violate the ethical obligation to understand the multifaceted nature of pediatric development and to address the root causes of functional limitations. Another incorrect approach that prioritizes a single theoretical model, such as exclusively applying Piagetian concepts without integrating information processing or executive function considerations, would also be professionally unacceptable. This would represent a narrow and potentially incomplete understanding of the child's cognitive landscape, leading to a suboptimal treatment plan. It fails to meet the standard of advanced practice expected of a PCS, which requires a sophisticated integration of multiple theoretical perspectives. A third incorrect approach that relies on anecdotal evidence or unvalidated interventions, disregarding established research on cognitive development and pediatric physical therapy, would be a significant ethical and regulatory breach. This would violate the core principle of evidence-based practice, potentially harming the child and undermining the credibility of the profession. It demonstrates a lack of commitment to continuous learning and the application of the most effective therapeutic strategies. A professional decision-making process for similar situations should involve a systematic evaluation of the child's presentation, a thorough review of relevant theoretical frameworks, Piaget, information processing, executive functions, an assessment of the child's performance within these frameworks, and the selection of interventions that are supported by evidence and aligned with the ethical and regulatory standards of pediatric physical therapy practice. This process emphasizes a holistic, evidence-informed, and individualized approach to care. Question 3. Quality control measures reveal that a pediatric physical therapist is consistently employing a single, broad-stroke developmental screening tool for all children presenting with suspected delays, without further in-depth assessment or consideration of specific functional domains. Which of the following approaches represents the most appropriate and ethically sound method for identifying, assessing, and intervening with developmental delays in this population? Adhering to best practices for a certified clinical specialist in pediatric physical therapy. Option A. Rely primarily on the results of the single screening tool, assuming it accurately reflects the child's overall developmental status, and proceeding with generalized interventions based on its findings. Option B. Implement a comprehensive assessment battery that includes standardized norm reference tests, criterion reference measures, direct functional observation, and detailed parent/caregiver interviews to establish a baseline and identify specific areas of delay for targeted intervention. Option C. Focus exclusively on interventions that address the most commonly observed delays in the general pediatric population, without a formal assessment of the individual child's specific needs. Option D. Utilize only informal observational techniques and subjective reports from parents to gauge the child's progress and adjust interventions as needed. The correct answer is B. Implement a comprehensive assessment battery that includes standardized norm reference tests, criterion reference measures, direct functional observation, and detailed parent/caregiver interviews to establish a baseline and identify specific areas of delay for targeted intervention. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in pediatric physical therapy. A child exhibiting subtle developmental delays that are not immediately apparent but could have significant long-term implications if unaddressed. The professional challenge lies in accurately identifying these delays, selecting appropriate and evidence-based assessment tools, and formulating an effective intervention plan that is both individualized and compliant with professional standards and regulatory guidelines. The pressure to provide timely and accurate care, while also managing parental expectations and resource limitations, adds to the complexity. Correct approach analysis. The correct approach involves a comprehensive, multifaceted evaluation that integrates standardized, criterion-referenced, and norm-referenced assessments, alongside direct observation and parent/caregiver input. This approach is considered best professional practice because it provides a holistic understanding of the child's functional abilities and limitations across various developmental domains. Regulatory and ethical frameworks, such as those guiding the Certified Clinical Specialist in Pediatric Physical Therapy, PCS, mandate the use of evidence-based practices and the principle of beneficence, ensuring that interventions are in the child's best interest and are supported by reliable data. This comprehensive assessment allows for precise identification of specific deficits, informs the development of individualized goals, and facilitates the selection of targeted intervention, thereby maximizing the potential for positive developmental outcomes. Incorrect approaches analysis. An approach that relies solely on informal observation and parental reports, without the use of standardized or criterion-referenced assessments, fails to meet the professional standard for accurate diagnosis and intervention planning. This approach lacks the objectivity and reliability required by regulatory bodies and ethical codes, which emphasize the importance of evidence-based practice. It risks misinterpreting the child's abilities or overlooking critical developmental deficits, potentially leading to delayed or inappropriate interventions, which violates the principle of non-maleficence. An approach that exclusively utilizes a single standardized assessment tool, without considering other assessment modalities or direct observation, is also professionally deficient. While standardized tests are valuable, they may not capture the full spectrum of a child's functional performance in real-world contexts. Over-reliance on a single tool can lead to an incomplete picture of the child's strengths and weaknesses, potentially resulting in a generalized intervention plan that is not optimally tailored to the child's unique needs. This can be seen as a failure to adhere to the principle of individualized care, cornerstone of pediatric physical therapy practice, an approach that prioritizes interventions based on anecdotal evidence or the therapist's personal experience alone, without a thorough assessment to identify specific deficits and establish baseline function, is ethically and professionally unsound. This approach bypasses the crucial step of diagnostic evaluation, which is essential for justifying the need for therapy and for measuring progress. It risks providing interventions that are not evidence-based or are misaligned with the child's actual developmental needs, potentially leading to ineffective treatment and a waste of resources, thereby failing to uphold the principles of efficacy and accountability. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the child's presenting concerns and medical history. This is followed by the selection of appropriate assessment tools that are valid, reliable, and relevant to the suspected developmental delays. The assessment process should be comprehensive, incorporating standardized measures, criterion-referenced evaluations, direct observation, and input from parents and caregivers. Based on the assessment findings, individualized, evidence-based goals and interventions are developed. Throughout the process, continuous monitoring of the child's progress and adjustment of the intervention plan are essential. This systematic approach ensures that care is patient-centered, evidence-based, and compliant with all relevant professional and regulatory standards. Question 4. Benchmark analysis indicates that a 4-year-old child presents with difficulties in manipulating small objects, such as placing pegs into a pegboard, and exhibits imprecise grasp patterns when holding a crayon. The physical therapist is tasked with conducting a risk assessment to inform the intervention plan. Which of the following approaches best reflects a comprehensive risk assessment for this child's fine motor development? Option A. Conduct a thorough assessment of the child's gross motor skills, postural control, visual perceptual abilities, and sensory processing, in addition to evaluating specific fine motor skills, to identify potential contributing factors and underlying impairments. Option B. Prioritize direct intervention focused on repetitive practice of isolated fine motor tasks to improve speed and accuracy, assuming the delays are primarily due to insufficient practice. Option C. Focus solely on the child's ability to imitate observed fine motor actions, assuming imitation is the primary driver of skill acquisition at this age. Option D. Recommend immediate referral to an occupational therapist for all fine motor concerns without conducting an initial physical therapy assessment to rule out physical impairments. The correct answer is B. Prioritize direct intervention focused on repetitive practice of isolated fine motor tasks to improve speed and accuracy, assuming the delays are primarily due to insufficient practice. Explanation. This scenario presents a professional challenge due to the need to balance evidence-based practice with the unique developmental trajectory and potential underlying etiologies of fine motor delays in a pediatric patient. The physical therapist must conduct a thorough risk assessment to identify factors that could impede progress or indicate a need for further medical evaluation, ensuring patient safety and optimal outcomes within the scope of pediatric physical therapy practice as defined by the American Physical Therapy Association, APTA, standards, and the Pediatric Clinical Specialist, PCS, certification requirements. The correct approach involves a comprehensive assessment that integrates observation of grasp patterns, manipulation skills, and hand-eye coordination with a consideration of the child's overall developmental status, medical history, and functional participation. This approach aligns with the PCS certification's emphasis on advanced clinical reasoning and evidence-based practice, requiring the therapist to synthesize information from multiple sources to formulate an individualized plan of care. It also adheres to APTA Code of Ethics, particularly principles related to patient welfare, professional competence, and the obligation to consult or refer when indicated. The risk assessment component is crucial for identifying potential red flags that might necessitate consultation with other healthcare professionals, thereby ensuring a holistic and safe approach to care. An incorrect approach would be to solely focus on isolated fine motor skill deficits without considering the broader context. For instance, attributing all fine motor delays to a lack of practice without investigating potential underlying neurological, sensory, or musculoskeletal factors would be a failure to conduct a thorough risk assessment. This overlooks the ethical obligation to identify and address all contributing factors to a patient's condition. Another incorrect approach would be to implement interventions without a clear rationale tied to the observed deficits and the child's functional goals, potentially leading to ineffective treatment and wasted resources. This deviates from the evidence-based practice mandate inherent in PCS certification. Furthermore, failing to recognize signs that warrant referral to a physician or other specialists, such as significant hypotonia, spasticity, or visual impairments impacting hand function, represents a critical ethical and professional lapse, potentially delaying diagnosis and appropriate medical management. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough subjective and objective examination, paying close attention to the specific fine motor skills in question. Second, integrate findings with the child's developmental history and any available medical information. Third, identify potential risk factors or red flags that require further investigation or consultation. Fourth, develop an evidence-based intervention plan that addresses identified deficits and functional goals. Finally, continuously reassess progress and adjust the plan of care as needed, always prioritizing patient safety and well-being within the established scope of practice. Question 5. Strategic planning requires a pediatric physical therapist to develop an individualized intervention program for a 5-year-old child with cerebral palsy. The therapist has identified specific functional goals related to mobility and self-care. Considering the child's home environment, which of the following approaches best reflects a comprehensive and ethically sound strategy for developing this plan? Option A. Proactively inquire about the family's socioeconomic status, cultural beliefs regarding disability and healthcare, and their access to transportation, financial resources, and community support systems to collaboratively tailor the intervention plan. Option B. Focus exclusively on the child's physical deficits and prescribe interventions that address these deficits directly, deferring any discussion of environmental or cultural factors to a later stage if they become apparent barriers. Option C. Develop a detailed treatment plan based solely on the child's clinical presentation and evidence-based interventions, assuming the family will find a way to implement it. Option D. Recommend a standard set of home exercise equipment and strategies that have proven effective for other children with similar diagnoses, without further investigation into the family's specific circumstances. The correct answer is C. Develop a detailed treatment plan based solely on the child's clinical presentation and evidence-based interventions, assuming the family will find a way to implement it. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pediatric physical therapist to navigate the complex interplay of socioeconomic status, cultural influences, and access to resources when developing a treatment plan. These environmental factors can significantly impact a child's ability to participate in therapy, adhere to recommendations, and achieve functional goals. A therapist must move beyond a purely clinical assessment to consider the broader context of the child's life, ensuring the plan is not only medically sound, but also practical and culturally sensitive. Failure to do so can lead to ineffective treatment, patient dissatisfaction, and potentially exacerbate existing disparities. Correct approach analysis. The correct approach involves a comprehensive assessment that actively seeks to understand the family's socioeconomic realities, cultural beliefs regarding health and disability, and their existing access to resources such as transportation, financial means for adaptive equipment, and community support systems. This information is then used to collaboratively develop a treatment plan that is tailored to the family's specific circumstances. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and justice, fair distribution of resources and opportunities, as well as the professional guidelines for patient-centered care, which emphasize shared decision-making and respect for individual values and preferences. Specifically, the American Physical Therapy Association, APTA, Standards of Practice for Physical Therapy, and the Code of Ethics for Physical Therapists underscore the importance of considering the patient's environment and social determinants of health in the provision of care. Incorrect approach is analysis, an approach that focuses solely on the child's physical impairments and prescribes a standard, resource-intensive intervention plan without considering the family's ability to implement it, fails to acknowledge the impact of socioeconomic status and access to resources. This can lead to a plan that is unrealistic and ultimately unsuccessful, violating the principle of beneficence by not truly acting in the patient's best interest. It also risks creating a barrier to care, which is contrary to the principles of justice. An approach that dismisses cultural beliefs as irrelevant to physical therapy intervention or attempts to impose a dominant cultural perspective demonstrates a lack of cultural competence. This can alienate the family, erode trust, and lead to non-adherence to the treatment plan, thereby undermining the effectiveness of therapy and violating the ethical imperative to respect patient autonomy and diversity. An approach that assumes all families have equal access to community resources and support systems, and therefore does not actively explore or address potential barriers, overlooks the significant impact of socioeconomic disparities. This can result in a treatment plan that is not feasible for the family to implement, leading to frustration and a lack of progress, which is a failure in providing equitable and effective care. Professional reasoning. Professionals should employ a shared decision-making model that begins with open-ended questions to elicit information about the family's environment, culture, and resources. This information should be integrated into the assessment and used to collaboratively develop a treatment plan that is both clinically appropriate and practically achievable. When barriers are identified, the therapist should explore potential solutions, which may include modifying the plan, connecting the family with community resources, or advocating for necessary support. This process ensures that the plan is patient-centered, culturally sensitive, and addresses the unique needs and circumstances of each child and family. Question 6. What factors determine the most appropriate selection and integration of standardized measures, such as the Gross Motor Function Classification System, GMFCS, and Manual Ability Classification System, MACS, for a comprehensive assessment of a pediatric patient's functional abilities within the U.S. regulatory framework? Option A. The insurance provider's reimbursement guidelines for specific assessment procedures. Option B. The recommendations of other healthcare professionals without independent verification of the tool's validity and reliability. Option C. The therapist's personal preference for certain assessment tools and the ease with which they can be administered. Option D. The child's age, diagnosis, the specific domains of motor function to be assessed, and the availability of validated and reliable tools that align with the APTA standards of practice and code of ethics. The correct answer is D. The child's age, diagnosis, the specific domains of motor function to be assessed, and the availability of validated and reliable tools that align with the APTA standards of practice and code of ethics. Explanation. This scenario is professionally challenging because it requires a pediatric physical therapist to synthesize information from multiple standardized assessments to accurately classify a child's functional abilities and inform intervention planning. The challenge lies in understanding the nuances of each classification system and how they interrelate, while adhering to the ethical and legal obligations of providing evidence-based care within the U.S. regulatory framework for physical therapy practice. The correct approach involves a comprehensive evaluation that integrates findings from the Gross Motor Function Classification System, GMFCS, and the Manual Ability Classification System, MACS, with other relevant standardized measures. This approach is justified by the American Physical Therapy Association, APTA, Standards of Practice and Code of Ethics, which mandate the use of valid and reliable assessment tools to establish a diagnosis, prognosis, and plan of care. Specifically, the APTA Code of Ethics emphasizes the physical therapist's responsibility to provide competent care and to use professional judgment in selecting and interpreting assessment data. The GMFCS and MACS are widely recognized and validated tools for classifying motor impairments in children with cerebral palsy, and their combined use provides a more holistic understanding of a child's functional limitations and strengths, directly informing the development of individualized and effective interventions. An incorrect approach would be to rely solely on one classification system without considering others or additional standardized measures. For instance, focusing only on the GMFCS might overlook specific limitations in fine motor skills that are crucial for participation in daily activities, such as schoolwork or self-care. This failure to conduct a thorough and comprehensive assessment violates the APTA standards of practice, which require the physical therapist to perform a comprehensive evaluation. Another incorrect approach would be to make assumptions about a child's abilities based on a single observation or a non-standardized assessment. This is ethically problematic as it deviates from evidence-based practice and could lead to an inaccurate diagnosis and inappropriate treatment plan, potentially harming the child and violating the principle of beneficence. Furthermore, failing to document the rationale for assessment choices and the interpretation of findings would be a breach of professional responsibility and could have legal implications if the care provided is later scrutinized. The professional decision-making process for similar situations should involve a systematic approach. First, identify the child's primary functional concerns and potential underlying impairments. Second, select the most appropriate and validated standardized assessment tools, considering the child's age, diagnosis, and the specific domains of function to be evaluated, e.g., gross motor, fine motor participation. Third, administer and score these assessments accurately and consistently. Fourth, interpret the results of each assessment in conjunction with the others, looking for patterns and discrepancies. Finally, synthesize this information to develop a comprehensive understanding of the child's functional profile, which then guides the development of evidence-based goals and interventions. This process ensures that the physical therapist is providing individualized, ethical, and legally compliant care. Question 7. Examination of the data shows a 6-month-old infant diagnosed with arthrogryposis multiplex congenita presenting with significant limitations in passive range of motion in all 4 extremities and muscle weakness. The family expresses concern about the child's ability to achieve developmental milestones and is eager for a treatment plan. Considering the principles of risk assessment in pediatric physical therapy, which of the following approaches best guides the initial management strategy? Option A. Conduct a comprehensive risk assessment that evaluates the child's current functional abilities, potential for progression of the condition, family's capacity for home-based interventions, and the evidence-based efficacy of various therapeutic approaches before initiating a specific intervention plan. Option B. Recommend immediate referral to a surgical specialist for corrective procedures without a prior physical therapy evaluation of the child's current functional status and potential for conservative management. Option C. Prioritize immediate, intensive stretching and strengthening exercises to maximize range of motion and muscle strength, assuming rapid progress is achievable. Option D. Focus solely on compensatory strategies to help the infant achieve functional milestones, as active range of motion and strength gains are unlikely given the diagnosis. The correct answer is C. Prioritize immediate, intensive stretching and strengthening exercises to maximize range of motion and muscle strength, assuming rapid progress is achievable. Explanation: this scenario is professionally challenging because it requires the pediatric physical therapist to balance the immediate need for intervention with the long-term implications of a congenital musculoskeletal condition, while adhering to the ethical and legal standards governing pediatric physical therapy practice in the United States. The therapist must consider the family's understanding, the child's developmental trajectory, and the evidence-based practices for managing such conditions. The correct approach involves a comprehensive risk assessment that integrates the child's current functional status, developmental milestones, family's capacity to support intervention, and potential for progression or regression of the condition. This approach aligns with the American Physical Therapy Association, APTA, Code of Ethics, which emphasizes the physical therapist's responsibility to provide competent care and to engage in informed decision-making with patients and families. Specifically, Principle 2.1 states that physical therapists shall demonstrate integrity in their relationships with patients, families, and colleagues, which includes open communication and shared decision-making. Furthermore, the APTA Guide to Physical Therapist Practice, a foundational document for the PCS certification, advocates for a systematic approach to patient management that includes examination, evaluation, diagnosis, prognosis, and intervention, all of which are informed by a thorough risk assessment. This approach ensures that interventions are tailored to the individual child's needs and that potential risks and benefits are carefully weighed. An incorrect approach would be to solely focus on the immediate functional limitations without considering the underlying etiology or the child's long-term prognosis. This failure to conduct a thorough risk assessment could lead to interventions that are not optimally aligned with the child's developmental needs or that do not adequately address the progressive nature of some congenital conditions. Ethically, this could violate the principle of providing appropriate and effective care. Another incorrect approach would be to defer all decision-making to the parents, without providing adequate information or guidance regarding the risks and benefits of different management strategies. While shared decision-making is crucial, the physical therapist has a professional obligation to educate and inform the family to enable them to make the best choices for their child. Failing to do so could be seen as a dereliction of professional duty and could lead to suboptimal outcomes. A further incorrect approach would be to implement a standardized intervention protocol without a personalized risk assessment. Congenital musculoskeletal conditions are diverse, and each child presents with unique challenges and potential risks. A one-size-fits-all approach neglects the individualized nature of care and the importance of adapting interventions based on ongoing assessment and risk evaluation, potentially leading to ineffective or even harmful interventions. The professional decision-making process for similar situations should involve a systematic evaluation of the child's condition, a thorough understanding of the relevant congenital musculoskeletal pathology, an assessment of the family's resources and goals, and a comprehensive risk-benefit analysis of potential interventions. This process should be guided by current evidence-based practice, ethical principles, and regulatory requirements, with open and honest communication with the family at every step. Question 8. When evaluating a 3-month-old infant with newly diagnosed bilateral congenital clubfoot and considering the family's expressed desire for the least invasive approach, which of the following strategies best aligns with current pediatric physical therapy practice and ethical guidelines for long-term management? Option A. Focusing solely on stretching exercises performed by the parents at home, with follow-up appointments scheduled only if significant functional decline is observed. Option B. Suggesting a trial of orthotic bracing without any initial casting or surgical intervention, with the expectation that this will correct the deformity over time. Option C. Initiating a comprehensive program of serial casting using the Pediatric method, coupled with ongoing physical therapy to address any residual stiffness or gait deviations, while maintaining open communication with the parents regarding progress and potential need for further interventions. Option D. Recommending immediate surgical correction to address the deformity definitively, assuring the parents that this will provide the quickest and most permanent solution. The correct answer is C. Initiating a comprehensive program of serial casting using the Pediatric method, coupled with ongoing physical therapy to address any residual stiffness or gait deviations, while maintaining open communication with the parents regarding progress and potential need for further interventions. Explanation: this scenario is professionally challenging because it requires a pediatric physical therapist to balance the immediate needs of a young child with clubfoot against the long-term goals of functional independence and minimizing recurrence, all while navigating the complexities of parental involvement and differing opinions on treatment efficacy. Careful judgment is required to ensure the chosen treatment plan is evidence-based, aligns with the family's values, and adheres to professional standards of care. The correct approach involves a comprehensive assessment of the child's current functional limitations, range of motion, and deformity severity, followed by a discussion with the parents about evidence-based treatment options, including the Pediatric method and surgical interventions, outlining the risks, benefits, and expected outcomes of each. This approach is justified by the American Physical Therapy Association, APTA, Standards of Practice for Physical Therapy, and the Code of Ethics for Physical Therapists, which mandate patient-centered care, informed consent, and the use of evidence-based interventions. Specifically, the APTA Code of Ethics emphasizes the physical therapist's duty to provide competent care and to educate patients and families to enable informed decision-making. This collaborative approach respects the family's autonomy and promotes adherence to the treatment plan. An incorrect approach would be to unilaterally recommend a specific treatment without a thorough assessment or detailed discussion of alternatives. This fails to meet the ethical obligation of informed consent, as parents are not given the full spectrum of information needed to make a decision. Another incorrect approach would be to dismiss parental concerns or preferences regarding treatment, which undermines the patient-centered care principle and can lead to distrust and noncompliance. Furthermore, recommending a treatment solely based on anecdotal evidence or personal preference, rather than established research and guidelines for clubfoot management, violates the professional standard of using evidence-based practice. Professional reasoning in such situations requires a systematic process. First, conduct a thorough and objective assessment. Second, gather information about evidence-based treatment options and their respective outcomes. Third, engage in open and honest communication with the family, actively listening to their concerns and values. Fourth, collaboratively develop a treatment plan that is both clinically sound and aligns with the family's goals. And finally, document the assessment, discussions, and agreed-upon plan thoroughly. Question 9. The efficiency study reveals that a pediatric physical therapy clinic is experiencing delays in functional mobility assessments due to the time required to administer and score various tests for strength and endurance. The clinic is seeking to streamline this process while maintaining the integrity of their assessments for children with diverse functional limitations. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for a certified clinical specialist in pediatric physical therapy, PCS, in assessing functional mobility, strength, and endurance? Option A. Focus solely on assessing gross motor functional mobility and delegate strength and endurance assessments to other disciplines without direct integration into the physical therapy plan of care. Option B. Implement a single, comprehensive, and validated pediatric functional mobility assessment tool that integrates measures of strength and endurance and provides standardized training to all therapists on its efficient and accurate administration. Option C. Encourage therapists to rely primarily on their clinical experience and subjective observations to gauge a child's functional mobility, strength, and endurance with minimal use of formal assessment tools. Option D. Adopt a functional mobility assessment tool designed for adults and adapt its administration and scoring for pediatric patients, prioritizing speed over established pediatric validation. Correct answer is B. Implement a single, comprehensive, and validated pediatric functional mobility assessment tool that integrates measures of strength and endurance and provides standardized training to all therapists on its efficient and accurate administration. Explanation: this scenario is professionally challenging because it requires a pediatric physical therapist to balance the need for efficient data collection with the ethical and regulatory imperative to provide individualized, evidence-based care. The Certified Clinical Specialist in Pediatric Physical Therapy, PCS, credential signifies a commitment to advanced practice, which includes adhering to the highest standards of assessment and documentation. The regulatory framework for physical therapy practice, particularly within the context of a specialist certification, emphasizes patient-centered care, accurate and comprehensive assessment, and the use of validated tools. The challenge lies in ensuring that efficiency measures do not compromise the depth and validity of the functional mobility, strength, and endurance assessments, which are critical for developing effective interventions for pediatric patients. The correct approach involves utilizing a standardized, evidence-based functional mobility assessment tool that is validated for the pediatric population and can be administered efficiently while capturing essential data on strength and endurance components. This approach is right because it aligns with the core principles of evidence-based practice and the regulatory requirements for competent and ethical physical therapy. Specifically, the use of a validated tool ensures the reliability and validity of the assessment findings, which are crucial for accurate diagnosis, treatment planning, and outcome measurement. Adherence to established assessment protocols also supports the professional responsibility to provide care that is consistent with current best practices and the standards expected of a PCS. This directly addresses the need for efficient data collection without sacrificing the quality or clinical utility of the information gathered. An incorrect approach would be to rely solely on subjective observations and informal measures of functional mobility, strength, and endurance without the use of standardized tools. This is professionally unacceptable because it lacks the objectivity and reliability required for accurate assessment and documentation. Regulatory frameworks for physical therapy emphasize the importance of objective data collection and the use of validated instruments to support clinical decision-making. Without such tools, the assessment findings are prone to bias and may not accurately reflect the child's functional status, leading to suboptimal treatment plans and potentially compromising patient outcomes. Furthermore, this approach fails to meet the advanced practice expectations associated with the PCS credential, which mandates the application of sophisticated and evidence-based assessment methodologies. Another incorrect approach would be to select a functional mobility assessment tool that is not validated for the pediatric population or does not adequately capture components of strength and endurance relevant to pediatric functional mobility. This is ethically and regulatorily flawed because it deviates from the principle of providing care based on evidence and best practices. Using an inappropriate tool can lead to misinterpretation of a child's abilities and limitations, resulting in ineffective interventions and potentially hindering progress. The PCS credential implies a responsibility to select and utilize assessment tools that are appropriate for the specific patient population and the clinical questions being addressed, ensuring that the data collected is meaningful and clinically actionable. A third incorrect approach would be to prioritize speed of administration over the thoroughness of the assessment, leading to incomplete data collection on functional mobility, strength, and endurance. This is a failure in professional responsibility and regulatory compliance. While efficiency is desirable, it should not come at the expense of a comprehensive evaluation. The regulatory framework for physical therapy, and particularly for specialist practice, requires a thorough assessment to inform the development of an individualized plan of care. Incomplete data collection can lead to an inaccurate understanding of the child's needs, resulting in a treatment plan that is not optimally tailored to their specific functional deficits, thereby failing to meet the standard of care expected of a PCS. The professional decision-making process for similar situations should involve a systematic evaluation of available assessment tools. This includes considering the tool's psychometric properties, validity, and reliability, its appropriateness for the pediatric population, its ability to capture relevant constructs, functional mobility, strength, endurance, and its feasibility for efficient administration within the clinical setting. The therapist must then select the tool that best balances these factors to ensure accurate, comprehensive, and clinically useful data collection, thereby upholding ethical obligations and regulatory requirements for specialized pediatric physical therapy practice. Question 10. Quality control measures reveal that a physical therapist has recommended a specific type of ankle-foot orthosis, a FO, for a pediatric patient with cerebral palsy to improve gait stability. The parents, however, express a strong preference for a different, less expensive AFO model they saw online, citing its aesthetic appeal and perceived ease of use, despite the therapist's concerns about its functional limitations for their child's specific needs. What is the most ethically and professionally appropriate course of action for the physical therapist? Option A. Inform the parents that their preference is not clinically appropriate and insist on the initially recommended AFO without further discussion, as the therapist's professional judgment is paramount. Option B. Proceed with fitting the less expensive AFO model requested by the parents to ensure family satisfaction and avoid conflict. Despite professional reservations about its efficacy, Option C. Engage in a detailed, collaborative discussion with the parents, presenting evidence-based rationale for the recommended AFO, addressing their concerns about cost and aesthetics, and exploring their understanding of the functional goals to arrive at a shared decision. Option D. Delay the orthotic intervention process and refer the family to another specialist, citing a lack of alignment in treatment philosophy without attempting to resolve the current disagreement. The correct answer is C. Engage in a detailed, collaborative discussion with the parents, presenting evidence-based rationale for the recommended AFO, addressing their concerns about cost and aesthetics, and exploring their understanding of the functional goals to arrive at a shared decision. Explanation. This scenario presents a professional challenge due to the inherent conflict between a parent's expressed wishes and the physical therapist's clinical judgment regarding the most appropriate orthotic intervention for a pediatric patient. The physical therapist must navigate this situation while adhering to the ethical principles of patient-centered care, beneficence, and non-maleficence, all within the regulatory framework governing physical therapy practice in the United States, as defined by the APTA Standards of Practice and Code of Ethics and relevant state practice acts. The correct approach involves a collaborative discussion with the parents, presenting evidence-based rationale for the recommended orthotic intervention, and actively listening to their concerns and preferences. This approach upholds the principle of informed consent and shared decision-making, which are cornerstones of ethical pediatric physical therapy. It acknowledges the parents as integral members of the care team and respects their role in advocating for their child. The physical therapist's responsibility is to educate and empower the parents to make the best decision for their child, even if it differs from their initial preference, by clearly articulating the potential benefits and risks of each option. This aligns with the APTA Code of Ethics, which emphasizes the physical therapist's duty to provide compassionate and competent care, and to respect the patient's right to make decisions about their health. An incorrect approach would be to dismiss the parent's concerns outright and unilaterally implement the orthotic device the therapist deems superior without further dialogue. This fails to respect the parent's autonomy and their right to participate in their child's care, potentially eroding trust and leading to noncompliance. Ethically, this could be viewed as paternalistic and a violation of the principles of shared decision-making. Another incorrect approach would be to concede to the parent's request for a less effective orthotic device solely to appease them, without thoroughly explaining the potential negative consequences or exploring alternative solutions. This would violate the principle of beneficence, as the therapist would not be acting in the child's best interest by providing suboptimal care. It also fails to uphold the therapist's professional responsibility to advocate for the most appropriate interventions. Finally, an incorrect approach would be to avoid the conversation altogether and delay the orthotic fitting, hoping the parents will change their minds. This inaction is a failure to provide timely and appropriate care, potentially hindering the child's progress and violating the therapist's duty to act in a timely manner. The professional reasoning process in such situations should involve 1. Actively listening to and acknowledging the parent's concerns and preferences. 2. Clearly and empathetically explaining the clinical rationale for the recommended intervention, including potential benefits and risks. 3. Exploring the parent's understanding of the condition and treatment goals. 4. Collaboratively problem-solving to find a mutually agreeable solution that prioritizes the child's well-being and functional outcomes, while respecting the family's values and beliefs. 5. Documenting the discussion, rationale, and agreed-upon plan. Question 11. Regulatory review indicates that a pediatric physical therapist is evaluating a 5-year-old child with spastic diplegic cerebral palsy. The therapist needs to determine the most appropriate approach for assessing the impact of the child's condition on their overall functioning and participation in meaningful activities. Which of the following approaches best aligns with current best practices and regulatory expectations for comprehensive impact assessment in pediatric rehabilitation? Option A. Prioritizing interventions aimed at achieving specific gross motor milestones, irrespective of the child's current participation levels or environmental demands. Option B. Focusing on a functional impact assessment that incorporates the child's participation in daily life activities, environmental factors, and family-identified goals alongside impairment measures. Option C. Relying solely on parental reports of the child's abilities without direct observation or standardized functional testing. Option D. Primarily utilizing standardized motor impairment assessments to quantify the severity of spasticity and range of motion limitations. The correct answer is D. Primarily utilizing standardized motor impairment assessments to quantify the severity of spasticity and range of motion limitations. Explanation. This scenario is professionally challenging because it requires a pediatric physical therapist to balance the immediate needs of a child with cerebral palsy (CP) and their family against the long-term implications of functional limitations and the need for ongoing, evidence-based interventions. The therapist must consider not only the child's current motor skills, but also their participation in meaningful activities, their potential for development, and the family's capacity to support the intervention plan. Careful judgment is required to avoid over- or undertreating, and to ensure that the chosen impact assessment approach aligns with professional standards and ethical obligations to the child and family. The correct approach involves a comprehensive, functional impact assessment that considers the child's participation in daily life activities, their environmental context, and their personal goals, in addition to their impairments. This aligns with the principles of the International Classification of Functioning, Disability, and Health (ICF) framework, which is widely adopted in pediatric rehabilitation and emphasizes a holistic view of health and disability. Specifically, it requires assessing how CP impacts the child's ability to engage in activities relevant to their age and developmental stage, such as playing, attending school, and interacting with peers. This approach is ethically justified as it prioritizes the child's overall well-being and promotes their inclusion and participation in society, which are core tenets of pediatric physical therapy practice. It also respects the family's perspective and goals for their child. An incorrect approach that focuses solely on the child's motor impairments without considering functional participation fails to address the broader impact of CP. This is ethically problematic as it may lead to interventions that do not translate into meaningful improvements in the child's daily life, potentially wasting resources and time. It also neglects the family's lived experience and their definition of success. Another incorrect approach that relies solely on standardized impairment-based tests without functional outcome measures risks overlooking critical aspects of the child's functional limitations and their impact on participation. This can lead to an incomplete understanding of the child's needs and may result in an intervention plan that is not sufficiently tailored to promote independence and quality of life. A third incorrect approach that prioritizes parental expectations over evidence-based functional goals without a collaborative discussion can lead to unrealistic expectations and potential dissatisfaction. While parental input is crucial, the therapist has a professional responsibility to guide the process with evidence-based practice and a focus on achievable functional outcomes. The professional decision-making process for similar situations should involve a systematic evaluation of the child's impairments, activity limitations, and participation restrictions using a combination of standardized and functional assessments. This should be conducted in collaboration with the child, as appropriate for their age and cognitive abilities, and their family to establish meaningful, individualized goals. The therapist should then select interventions that are evidence-based and directly address these goals, with a plan for ongoing reassessment of functional impact and participation. Question 12. Compliance review shows a pediatric physical therapist is evaluating a 15-month-old child who is pulling to stand and cruising along furniture, but is not yet walking independently. The parent expresses concern that the child is behind other children they know. The therapist must determine the most appropriate course of action. Which of the following approaches best reflects adherence to the regulatory framework and professional guidelines for a certified clinical specialist in pediatric physical therapy? Option A. Immediately refer the child for a neurological evaluation, as any delay in independent walking beyond 15 months is indicative of a significant underlying issue. Option B. Reassure the parent that walking typically occurs between 9 and 18 months and advise them to wait another month before considering any further evaluation. Option C. Conduct a comprehensive gross motor assessment to evaluate the child's current functional abilities. Compare findings to age-appropriate milestones and typical developmental sequences, and provide education to the parent regarding the wide range of normal variations in walking onset. Option D. Focus solely on the parent's expressed concern and recommend a home exercise program designed to force independent walking, without a formal assessment of the child's current gross motor skills. The correct answer is C. Conduct a comprehensive gross motor assessment to evaluate the child's current functional abilities, compare findings to age-appropriate milestones and typical developmental sequences, and provide education to the parent regarding the wide range of normal variations in walking onset. Explanation. This scenario presents a professional challenge because it requires a pediatric physical therapist to differentiate between typical variations in gross motor development and potential red flags that warrant further investigation or intervention, all within the context of established pediatric physical therapy practice standards. The challenge lies in accurately assessing a child's gross motor skills against a backdrop of developmental sequences, and recognizing when a deviation might indicate an underlying condition, impacting the child's functional participation and long-term outcomes. This requires a nuanced understanding of developmental trajectories and the ability to apply clinical reasoning ethically and effectively. The correct approach involves a comprehensive assessment of the child's gross motor skills, comparing them against established developmental milestones and sequences for their age. This approach is grounded in the ethical principles of beneficence and non-maleficence, as well as the professional standards of care for pediatric physical therapy. By systematically evaluating the child's current abilities and identifying any significant delays or atypical patterns, the therapist can determine the appropriate course of action, which may include further evaluation, intervention, or reassurance. This aligns with the core responsibilities of a certified clinical specialist in pediatric physical therapy to promote optimal development and function. An incorrect approach that relies solely on parental reports without objective assessment fails to meet the standard of care. This approach risks overlooking objective signs of developmental delay or atypical movement patterns, potentially delaying necessary interventions and violating the principle of beneficence by not acting in the child's best interest. Another incorrect approach that dismisses any deviation from the most common developmental timeline as simply a variation, without considering the potential implications of atypical sequences or significant delays, also fails to uphold professional responsibilities. This could lead to missed opportunities for early intervention, which is critical in pediatric physical therapy for maximizing functional outcomes. A third incorrect approach that immediately labels any deviation as a pathology without a thorough, age-appropriate assessment and consideration of typical variations is also professionally unsound. This can lead to unnecessary anxiety for parents and potentially inappropriate referrals, violating the principle of non-maleficence by causing harm through overintervention or misdiagnosis. Professionals should employ a decision-making process that begins with a thorough understanding of gross motor development across the lifespan, including typical milestones, sequences, and the wide range of acceptable variations. This is followed by a systematic, objective assessment of the child's current gross motor abilities, utilizing standardized and non-standardized measures as appropriate. Clinical reasoning then involves comparing these findings to established norms, considering the child's age, medical history, and environmental factors. If significant deviations or atypical patterns are identified, the next step is to determine the need for further evaluation, consultation with other professionals, or the initiation of a targeted intervention plan, always prioritizing the child's well-being and functional progress. Question 13. The assessment process reveals that a 4-year-old child with cerebral palsy exhibits significant difficulties in following multi-step verbal commands during functional mobility tasks and struggles to initiate communication to express their needs or desires during play activities. Which of the following represents the most appropriate best practice approach for the pediatric physical therapist to address these observed language-related challenges within their scope of practice? Option A. Integrate functional observation and targeted use of age-appropriate, non-standardized assessment techniques that evaluate the child's ability to understand and respond to movement-related verbal cues and to express needs through verbal or non-verbal means during physical therapy sessions. Option B. Focus solely on improving gross motor skills, assuming that language development will improve concurrently with motor gains, and defer any language concerns to the child's parents. Option C. Rely exclusively on informal observation of the child's interactions and communication attempts during therapy sessions, without employing any structured or standardized tools to document findings. Option D. Administer a comprehensive battery of standardized speech-language pathology assessments to determine the precise nature and severity of the receptive and expressive language deficits. The correct answer is D. Administer a comprehensive battery of standardized speech-language pathology assessments to determine the precise nature and severity of the receptive and expressive language deficits. Explanation: this scenario presents a professional challenge because it requires a pediatric physical therapist to accurately assess and interpret complex language development skills within the scope of their practice, while adhering to specific regulatory and ethical guidelines for pediatric physical therapy in the United States. The challenge lies in distinguishing between what falls within the physical therapist's expertise and what necessitates referral to other disciplines, ensuring the child receives appropriate and timely care without overstepping professional boundaries. Careful judgment is required to select the most effective and ethically sound evaluation methods. The correct approach involves utilizing standardized and non-standardized assessment tools that are within the scope of physical therapy practice to evaluate receptive and expressive language skills as they relate to functional mobility, play, and participation. This includes observing how a child understands and responds to verbal cues for movement, their ability to express needs and desires through verbal or nonverbal means during physical activity, and their engagement in play that involves communication. This approach aligns with the American Physical Therapy Association, APTA, standards of practice and the Pediatric Clinical Specialist, PCS, certification requirements, which emphasize a holistic approach to pediatric care that integrates functional abilities with communication. Ethical practice dictates that physical therapists assess all factors impacting a child's functional mobility and participation, including communication, and refer to other professionals when a child's needs extend beyond the therapist's scope of expertise. An incorrect approach that relies solely on formal speech-language pathology assessments would be a failure to practice within the defined scope of physical therapy. While understanding the results of such assessments is crucial, conducting them without appropriate licensure or certification as a speech-language pathologist is outside the physical therapist's purview and could be considered practicing outside their scope, potentially violating state practice acts and APTA ethical guidelines. Another incorrect approach, focusing exclusively on gross motor skills without considering the impact of language on functional participation, would be a failure to provide comprehensive care. The PCS certification emphasizes the integration of various developmental domains, ignoring receptive and expressive language skills, which directly influence a child's ability to understand instructions for movement, participate in therapeutic activities, and express their needs during therapy, would result in an incomplete assessment and potentially suboptimal treatment planning. This neglects the interconnectedness of development and fails to meet the comprehensive care standards expected of a specialist. A third incorrect approach, relying on informal observation alone without the use of any standardized or structured assessment tools, would also be professionally deficient. While informal observation is a valuable component of assessment, it lacks the objectivity and reliability of standardized measures. Without incorporating some form of structured evaluation, the assessment may be subjective and difficult to track progress against, potentially leading to inaccurate conclusions about the child's language development in relation to their physical therapy goals. This falls short of the best practice standards for specialist-level evaluation. The professional decision-making process for similar situations should involve a clear understanding of the physical therapist's scope of practice as defined by state licensure laws and professional organizations like the APTA. It requires recognizing the interconnectedness of developmental domains and their impact on functional mobility and participation. When assessing a child, the therapist should ask, what aspects of language development directly impact this child's ability to move, play, and participate in their environment, and are within my assessment capabilities? If the assessment reveals significant deficits that clearly fall under the purview of another profession, the ethical and professional responsibility is to make a timely and appropriate referral. Question 14. The performance metrics show a pediatric patient presenting with significant motor weakness in the lower extremities, decreased sensation in a stocking glove distribution, and reports of intermittent bowel and bladder incontinence. The physical therapist's initial assessment confirms the motor weakness and sensory loss. What is the most appropriate next step in the decision-making process? Adhering strictly to the regulatory framework and ethical guidelines for certified clinical specialists in pediatric physical therapy in the U.S. Option A. Refer the patient to a physician for further medical evaluation to investigate the cause of the bowel and bladder dysfunction and collaborate with the medical team on a comprehensive care plan. Option B. Initiate a physical therapy program focused on strengthening and balance exercises, and educate the family on basic bowel and bladder hygiene strategies. Option C. Recommend adaptive equipment for mobility and continue to monitor the bowel and bladder symptoms without immediate referral, assuming they will resolve with improved motor control. Option D. Focus solely on improving motor function, as sensory loss and bowel/bladder issues are outside the primary scope of physical therapy for this age group. The correct answer is B. Initiate a physical therapy program focused on strengthening and balance exercises, and educate the family on basic bowel and bladder hygiene strategies. Explanation: scenario analysis. This scenario is professionally challenging because it requires the pediatric physical therapist to integrate complex neurological findings, motor weakness, sensory loss, bowel/bladder dysfunction, with the specific regulatory and ethical obligations governing pediatric physical therapy practice within the United States, as defined by the American Physical Therapy Association, APTA, Standards of Practice and Code of Ethics, and relevant state practice acts. The therapist must make a critical decision regarding the appropriate level of intervention and referral, ensuring patient safety, efficacy of care, and adherence to professional scope of practice. The potential for misinterpretation of findings or inadequate referral could lead to suboptimal outcomes or harm to the child. Correct approach analysis. The correct approach involves a comprehensive assessment that specifically addresses the interplay between motor weakness, sensory deficits, and bowel/bladder dysfunction, followed by a collaborative decision-making process with the child's family and the interdisciplinary team. This aligns with the APTA Code of Ethics, which emphasizes the physical therapist's responsibility to provide competent care, to consult with other professionals when indicated, and to advocate for the patient. Specifically, Principle 4.1 states that physical therapists shall respect the rights, safety, and dignity of all individuals. Furthermore, Principle 4.1 mandates that physical therapists provide services within their scope of practice and shall not engage in the unlicensed practice of physical therapy, recognizing the potential for bowel/bladder dysfunction to indicate a more significant neurological issue requiring specialized medical management. A referral to a physician or appropriate specialist is ethically and professionally mandated if the physical therapist's assessment suggests this need, rather than attempting to manage it solely within the physical therapy scope without medical oversight. Incorrect approach is analysis, an approach that focuses solely on improving motor strength without adequately assessing or addressing the sensory loss and bowel/bladder dysfunction, fails to provide holistic care, and may overlook critical underlying neurological issues. This violates the ethical principle of providing comprehensive and competent care. An approach that attempts to manage bowel and bladder dysfunction through physical therapy interventions alone, without physician referral or collaboration, exceeds the typical scope of physical therapy practice for such symptoms, and could lead to delayed diagnosis or inappropriate treatment of a potentially serious medical condition. This contravenes the principle of practicing within one's scope and the responsibility to refer when necessary. An approach that dismisses the bowel/bladder dysfunction as unrelated to the motor and sensory impairments without further investigation or consultation is a failure to exercise due diligence and professional judgment, potentially compromising the patient's overall health and well-being. This demonstrates a lack of thoroughness and adherence to the ethical imperative of patient advocacy and comprehensive assessment. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough, evidence-based assessment of all reported impairments. This framework should include 1. Identifying the specific functional limitations and impairments. 2. Considering the potential underlying etiologies and their implications for the child's overall health. 3. Determining the extent to which these impairments fall within the physical therapist's scope of practice. 4. Identifying when consultation or referral to other healthcare professionals is necessary for accurate diagnosis and comprehensive management. And 5. Collaborating with the patient and family to develop a safe and effective plan of care that respects their values and goals, all while adhering to the APTA standards of practice and code of ethics. Question 15. Research into the impact of hypozygomatic encephalopathy, HI, on motor control in a 12-month-old infant reveals specific patterns of spasticity and impaired voluntary movement. Given this information, which of the following approaches best guides the physical therapist's assessment and intervention planning? Option A. Focus primarily on the infant's chronological age and compare their motor skills to general developmental norms, adjusting therapy based on perceived delays. Option B. Rely predominantly on parental descriptions of the infant's motor abilities to formulate the treatment plan, minimizing direct therapist assessment of motor control. Option C. Directly correlate the observed motor impairments with the known neuroanatomical areas typically affected by HIE and Taylor intervention to address these specific deficits and their functional consequences. Option D. Prioritize interventions that address gross motor milestones, without a detailed analysis of how the HIE specifically contributes to the observed motor challenges. The correct answer is C. Directly correlate the observed motor impairments with the known neuroanatomical areas typically affected by HIE and Taylor interventions to address these specific deficits and their functional consequences. Explanation. This scenario presents a common yet complex challenge for a pediatric physical therapist, interpreting the impact of a specific type of brain injury on motor control in a young child, and then developing an appropriate intervention plan. The professional challenge lies in synthesizing knowledge of neuroanatomy, developmental neuroscience, and the specific pathophysiology of hypozygomatic encephalopathy, HI, to predict functional deficits and guide therapy. This requires not only clinical expertise, but also adherence to professional standards of practice and ethical considerations regarding patient care and family communication. The correct approach involves a comprehensive assessment that directly links the observed motor impairments to the documented HIE, considering the typical patterns of motor dysfunction associated with this injury. This approach prioritizes evidence-based practice and a patient-centered philosophy, aligning with the American Physical Therapy Association, APTA, standards of practice for physical therapy and the Code of Ethics. Specifically, it emphasizes the physical therapist's responsibility to provide competent care based on the best available evidence and to advocate for the patient's needs. The APTA Guide to Physical Therapist Practice, which is foundational for the PCS exam, stresses the importance of understanding the impact of underlying pathology on function. An incorrect approach would be to focus solely on the gross motor milestones, without a clear connection to the HIE's pathophysiology. This fails to demonstrate a deep understanding of the underlying neurological deficits and may lead to ineffective or inappropriate interventions. Ethically, it could be seen as a failure to provide specialized care commensurate with the clinical specialist credential. Another incorrect approach would be to generalize motor deficits based on the age of the child, without considering the specific neurological insult. This overlooks the unique impact of HIE and deviates from the principle of individualized care. It also risks misinterpreting the child's potential and may lead to setting unrealistic or insufficient therapeutic goals. A third incorrect approach would be to rely solely on parental reports of motor function without conducting an objective, therapist-led assessment. While parental input is crucial, the physical therapist's role is to provide an expert, objective evaluation of motor control, which is essential for accurate diagnosis and treatment planning. Failure to do so would be a breach of professional responsibility and could lead to misdiagnosis and suboptimal outcomes. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the specific diagnosis and its known pathophysiological sequelae. Second, conducting a comprehensive, individualized assessment that identifies specific motor impairments and their likely neurological origins. Third, integrating this information with current evidence-based practice guidelines for pediatric neurological rehabilitation. And finally, developing a targeted intervention plan in collaboration with the child's family and the interdisciplinary team. Question 16. To address the challenge of managing a pediatric patient diagnosed with progressive idiopathic scoliosis, which of the following approaches best reflects the advanced clinical reasoning and ethical responsibilities expected of a certified clinical specialist in pediatric physical therapy, PCS, when considering bracing and potential surgical interventions? Option A. Recommend immediate surgical consultation for the patient, regardless of the current curve severity or progression rate, based on the diagnosis of scoliosis. Option B. Focus solely on fitting and adjusting a thoracolumbossacral orthosis, TLSO, for the patient, as bracing is the primary intervention for scoliosis, and defer any discussion of surgical options unless explicitly requested by the parents. Option C. Initiate a comprehensive physical therapy program focused on strengthening and stretching exercises, and if radiographic evidence shows progression beyond a specific threshold, refer the patient for an orthopedic surgical consultation while continuing to manage bracing if already in place. Option D. Advise the parents that physical therapy alone can effectively manage and correct the scoliosis, and that bracing or surgery are typically unnecessary interventions for most pediatric cases. The correct answer is C. Initiate a comprehensive physical therapy program focused on strengthening and stretching exercises, and if radiographic evidence shows progression beyond a specific threshold, refer the patient for an orthopedic surgical consultation while continuing to manage bracing if already in place. Explanation. This scenario is professionally challenging because it requires a physical therapist to navigate the complexities of pediatric scoliosis management, balancing evidence-based practice with the specific regulatory and ethical obligations governing the Certified Clinical Specialist in Pediatric Physical Therapy, PCS, credential. The PCS credential signifies a commitment to advanced knowledge and practice within the pediatric domain, implying adherence to the highest standards of care as defined by the relevant professional bodies and regulatory frameworks. The challenge lies in accurately assessing the patient's condition, recommending appropriate interventions, bracing or surgical consultation, and ensuring that these recommendations are communicated and implemented in a manner that respects patient autonomy, parental consent, and the scope of practice as defined by the credentialing body and state licensure laws. The correct approach involves a comprehensive assessment of the pediatric patient's scoliosis, including radiographic review, if available, clinical examination for curve progression, and functional evaluation. Based on this assessment, the physical therapist must then determine the most appropriate next step, which may include initiating or continuing conservative management such as bracing, or referring for surgical consultation if the curve meets specific criteria for surgical intervention. This approach is correct because it aligns with the PCS credential's emphasis on advanced clinical reasoning and evidence-based practice in pediatric physical therapy. It also adheres to the ethical principles of beneficence and non-maleficence, ensuring the patient receives the most appropriate and least invasive intervention necessary. Furthermore, it respects the collaborative nature of healthcare, recognizing when the expertise of other medical professionals, such as orthopedic surgeons, is required. This aligns with the regulatory framework that expects specialists to practice within their scope and to facilitate appropriate referrals. An incorrect approach would be to solely focus on bracing without considering the severity of the curve or the potential need for surgical intervention. This fails to meet the advanced assessment requirements of the PCS credential and could lead to delayed or inappropriate care, potentially violating the principle of beneficence. Another incorrect approach would be to recommend surgical intervention directly without a thorough assessment and consultation with an orthopedic surgeon. This oversteps the scope of practice for a physical therapist and neglects the collaborative care model, potentially causing harm and violating ethical and regulatory boundaries. Finally, an incorrect approach would be to dismiss the need for further intervention based on parental preference alone, without providing comprehensive information about the risks and benefits of all available options, including bracing and surgical consultation. This undermines the principle of informed consent and fails to uphold the professional responsibility to advocate for the patient's best interests as defined by current clinical guidelines and the PCS credential standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available clinical information, including patient history, physical examination findings, and any diagnostic imaging. 2. Apply advanced clinical reasoning skills, informed by the latest evidence-based guidelines for pediatric scoliosis management, to determine the most appropriate course of action. 3. Consult with relevant healthcare professionals such as orthopedic surgeons when the patient's condition warrants it or when there is uncertainty. 4. Engage in open and honest communication with the patient and their family, providing clear explanations of the assessment findings, treatment options, potential risks and benefits, and the rationale for recommendations. 5. Document all assessments, interventions, consultations, and communications meticulously. 6. Continuously engage in professional development to maintain and enhance expertise in pediatric physical therapy, particularly in areas like scoliosis management, to ensure practice remains aligned with the PCS credential standards and regulatory requirements. Question 17. Analysis of a 7-year-old male presenting with progressive proximal muscle weakness, gait abnormalities, and elevated creatine kinase levels, who has been diagnosed with Becker muscular dystrophy, BMD. Considering the similarities and differences between BMD and Duchenne muscular dystrophy, DMD, what is the most appropriate approach for a certified clinical specialist in pediatric physical therapy, PCS, to undertake regarding risk assessment for this patient? Option A. Conduct a comprehensive functional assessment and develop an individualized intervention plan that acknowledges the typically slower progression and milder phenotype of BMD compared to DMD, focusing on maintaining ambulation, preventing contractures, and monitoring for cardiac and respiratory involvement, while educating the family on the expected long-term trajectory. Option B. Prioritize interventions to address immediate functional limitations without a long-term risk assessment, as the variability in BMD progression makes predicting future needs unreliable and potentially anxiety-provoking for the family. Option C. Focus solely on the genetic diagnosis of BMD and initiate a standardized exercise program without considering the specific clinical presentation or the differential prognosis compared to DMD, as the underlying genetic defect is the primary concern. Option D. Assume the patient will experience rapid functional decline and significant cardiac involvement similar to DMD, and implement an aggressive, early intervention program aimed at maximizing strength and endurance to delay inevitable functional loss. The correct answer is A. Conduct a comprehensive functional assessment and develop an individualized intervention plan that acknowledges the typically slower progression and milder phenotype of BMD compared to DMD, focusing on maintaining ambulation, preventing contractures, and monitoring for cardiac and respiratory involvement, while educating the family on the expected long-term trajectory. Explanation: this scenario is professionally challenging because it requires a pediatric physical therapist to accurately differentiate between two similar but distinct neuromuscular conditions, Becker muscular dystrophy, BMD, and Duchenne muscular dystrophy, DMD, to inform appropriate risk assessment and intervention planning. Misidentification can lead to delayed or inappropriate care, impacting the child's functional outcomes and quality of life. The therapist must apply a nuanced understanding of the progressive nature, severity, and typical trajectory of each condition within the context of U.S. regulatory frameworks governing pediatric healthcare and physical therapy practice. The correct approach involves a comprehensive assessment that considers the differential diagnostic features of BMD and DMD, focusing on the rate of progression, severity of muscle weakness, presence of cardiac involvement, and typical age of onset and ambulation loss. This approach aligns with the ethical imperative to provide evidence-based care and the legal requirement to practice within the scope of physical therapy as defined by state practice acts and APTA guidelines. Specifically, the therapist must recognize that while both are X-linked recessive disorders affecting dystrophin, BMD typically presents with slower progression, milder weakness, and later onset of significant disability compared to DMD. Cardiac involvement, while present in both, is often less severe and progresses more slowly in BMD. This differential diagnosis is crucial for accurate prognostication and tailoring the physical therapy plan to the child's specific needs and anticipated disease course, thereby minimizing risks associated with over- or undertreatment. An incorrect approach would be to assume all muscular dystrophies are clinically identical and to apply a generic intervention plan without considering the specific diagnostic implications of BMD versus DMD. This fails to acknowledge the distinct natural histories and prognoses of these conditions, potentially leading to inappropriate risk stratification. For instance, assuming the rapid decline characteristic of DMD for a child with BMD could lead to unnecessary anxiety for the family and an overly aggressive intervention strategy that may not be warranted by the child's actual functional capacity and disease progression. This also violates the principle of patient-centered care, which necessitates individualized treatment based on accurate diagnosis and prognosis. Another incorrect approach would be to solely rely on genetic testing results without integrating clinical presentation and functional assessment. While genetic testing confirms the diagnosis, the clinical manifestations and rate of progression are paramount for risk assessment and intervention planning in pediatric physical therapy. Focusing exclusively on the genetic marker without considering the phenotypic expression and its impact on the child's functional abilities represents a failure to provide holistic care and an incomplete risk assessment. The professional decision-making process for similar situations should involve a systematic approach. 1. Accurate diagnosis and differential diagnosis. Thoroughly review medical history, diagnostic reports, including genetic testing, and perform a comprehensive physical examination to confirm the diagnosis and differentiate between similar conditions. 2. Understanding disease trajectory. Familiarize oneself with the typical progression, severity, and potential complications of the diagnosed condition, BMD in this case, and compare it to closely related conditions, DMD. 3. Risk assessment. Identify potential risks associated with the condition and its progression, considering factors like respiratory compromise, cardiac involvement, orthopedic deformities, and functional limitations. 4. Intervention planning. Develop an individualized, evidence-based physical therapy plan that addresses the child's current functional status, anticipates future needs, and aims to optimize function, prevent secondary complications, and enhance quality of life, while considering the specific prognosis of BMD. 5. Communication and collaboration. Maintain open communication with the child, family, and the interdisciplinary healthcare team, ensuring shared understanding of the diagnosis, prognosis, and treatment plan. Question 18. The investigation demonstrates a 5-year-old child presenting with significant challenges in following multi-step motor commands during a physical therapy session aimed at improving balance and coordination. The therapist observes that the child appears to understand individual words, but struggles to sequence the actions required, often becoming distracted or attempting only the first step. The therapist also notes that the child has difficulty anticipating the next movement in a sequence and initiating the task independently. Considering the principles of cognitive development relevant to pediatric physical therapy practice in the United States, which of the following approaches best reflects the physical therapist's role and responsibilities? Option A. Adapt the physical therapy interventions by breaking down complex motor sequences into single steps, providing clear visual cues, and offering frequent positive reinforcement for task completion, while documenting observations of the child's attention and sequencing abilities to inform future sessions and potential collaboration with other professionals. Option B. Directly diagnose the child with a specific executive function deficit, such as deficits in working memory and planning, and initiate a program of cognitive remediation exercises within the physical therapy sessions. Option C. Focus exclusively on gross motor skill acquisition, assuming the child's difficulties are solely motor-based, and disregard the observed challenges in sequencing and initiation as unrelated to the physical therapy goals. Option D. Recommend that the child's parents seek immediate consultation with a speech-language pathologist for a comprehensive language evaluation, assuming the child's difficulties are primarily a communication disorder. Correct answer is A. Adapt the physical therapy interventions by breaking down complex motor sequences into single steps, providing clear visual cues, and offering frequent positive reinforcement for task completion, while documenting observations of the child's attention and sequencing abilities to inform future sessions and potential collaboration with other professionals. Explanation. This scenario presents a professional challenge due to the need to accurately assess a child's cognitive development within the context of their physical therapy intervention, while adhering to the ethical and legal standards governing pediatric physical therapy practice in the United States. The challenge lies in distinguishing between a child's actual cognitive limitations and potential deficits in their ability to demonstrate their understanding due to communication barriers or the specific demands of the assessment. A physical therapist must operate within their scope of practice, which includes understanding and applying principles of cognitive development to inform treatment, but not to diagnose cognitive impairments. The ethical imperative is to provide evidence-based care that respects the child's dignity and promotes their functional independence, avoiding overreach into diagnostic territories reserved for other professionals. The correct approach involves integrating observations of the child's cognitive engagement and problem-solving during physical therapy sessions with established knowledge of Piaget stages, information processing, and executive functions. This integration allows the therapist to adapt interventions to the child's current cognitive abilities, such as using concrete examples for a child in the preoperational stage or breaking down complex motor tasks for a child with underdeveloped executive functions. This approach is ethically justified by the American Physical Therapy Association, APTA, Code of Ethics, which emphasizes the therapist's responsibility to provide competent care and to collaborate with other healthcare professionals. Specifically, Principle 4. 1 states that physical therapists shall provide compassionate and responsive patient-centered care, and Principle 4 states that physical therapists shall consult with other professionals when indicated to ensure the needs of the patient are met. This approach respects the child's developmental trajectory and informs the physical therapy plan without overstepping professional boundaries. An incorrect approach would be to directly diagnose a cognitive deficit based solely on performance during physical therapy. This fails to acknowledge the limitations of a physical therapy assessment in definitively identifying cognitive disorders and violates the principle of practicing within one's scope of expertise. Such an approach could lead to mislabeling the child, potentially impacting their educational and therapeutic pathways negatively, and could be seen as a breach of professional conduct by the Physical Therapy Board of the relevant U.S. state, as it may constitute practicing outside the scope of physical therapy. Another incorrect approach would be to ignore the child's cognitive engagement entirely and focus solely on motor performance. This neglects a crucial aspect of a child's overall development and can lead to ineffective or inappropriate interventions. For instance, a child struggling with a motor task might be exhibiting difficulties related to working memory or planning, executive functions, rather than a primary motor impairment. Failing to consider these cognitive factors can result in frustration for the child and suboptimal therapeutic outcomes, which is contrary to the APTA emphasis on patient-centered care and the pursuit of optimal outcomes. A third incorrect approach would be to recommend specific cognitive remediation strategies that are outside the scope of physical therapy. While a physical therapist can adapt their methods to support cognitive development, they are not trained or licensed to provide direct cognitive therapy. Referring the child for a comprehensive neuropsychological evaluation when cognitive concerns are significant and impacting functional goals is the appropriate course of action, rather than attempting to address these issues directly without proper training and licensure. This failure to refer appropriately can be considered a lapse in professional judgment and a potential violation of ethical obligations to ensure the child receives the most appropriate care. The professional decision-making process for similar situations should involve a systematic evaluation of the child's presentation, considering all contributing factors, including cognitive aspects. The therapist should ask, what is the child's current functional level and what cognitive factors might be influencing this? Then, they should consider, how can I adapt my physical therapy interventions to better support this child's cognitive strengths and challenges within my scope of practice? Finally, if cognitive concerns are significant and beyond the therapist's expertise, the crucial question becomes, what is the most appropriate referral to ensure this child receives comprehensive care? This iterative process, grounded in ethical principles and professional scope, guides effective and responsible practice. Question 19. During the evaluation of a 5-year-old child with cerebral palsy, the parents express a strong desire for a specific therapeutic approach they read about online, which the pediatric physical therapist, a certified clinical specialist in pediatric physical therapy, PCS, believes is not the most evidence-based or functionally relevant intervention for this child's current presentation. What is the most appropriate course of action for the PCS specialist? Option A. Immediately implement the therapeutic approach requested by the parents, as respecting parental wishes is paramount in pediatric care. Option B. Inform the parents that their requested approach is not evidence-based and proceed with a standardized treatment protocol for children with similar diagnoses. Option C. Proceed with a treatment plan based solely on the child's diagnosis, without a detailed functional assessment or significant parental input. Option D. Conduct a comprehensive functional assessment. Develop an individualized, evidence-based treatment plan addressing the child's specific impairments and functional goals, and then collaboratively discuss this plan with the parents, explaining the rationale and addressing their concerns. The correct answer is D. Conduct a comprehensive functional assessment. Develop an individualized, evidence-based treatment plan addressing the child's specific impairments and functional goals, and then collaboratively discuss this plan with the parents, explaining the rationale and addressing their concerns. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the pediatric physical therapist to navigate the complex interplay between parental wishes, the child's best interests, and the established scope of practice for a certified clinical specialist in pediatric physical therapy, PCS. The therapist must balance respecting parental autonomy with their ethical and legal obligation to provide evidence-based care that aligns with their specialized expertise. The challenge is amplified by the potential for differing interpretations of best interest and the need to maintain professional boundaries while fostering a collaborative relationship. Correct approach analysis. The correct approach involves a comprehensive assessment of the child's functional abilities and limitations, followed by the development of a treatment plan that is evidence-based, individualized, and directly addresses the identified impairments. This approach is justified by the PCS credential, which signifies advanced knowledge and skills in pediatric physical therapy. The American Physical Therapy Association, APTA, Standards of Practice and Code of Ethics, which govern PCS certified professionals in the U.S., mandate that physical therapists provide care based on the best available evidence and in the best interest of the patient. This includes advocating for interventions that are appropriate and effective, even if they differ from parental preferences, while maintaining open communication and shared decision-making. Incorrect approach is analysis, an approach that solely defers to parental requests without a thorough, evidence-based assessment risks providing suboptimal or even harmful care. This fails to uphold the therapist's professional responsibility to act in the child's best interest and could violate the APTA code of ethics regarding competence and professional judgment. An approach that rigidly adheres to a preconceived treatment plan without considering the child's current functional status or the family's input neglects the principles of patient-centered care and individualized treatment. This can lead to a lack of buy-in from the family and may not effectively address the child's evolving needs, potentially violating ethical guidelines on respecting patient values and preferences. An approach that focuses solely on the child's diagnosis without a functional assessment overlooks the core principles of pediatric physical therapy, which emphasize improving functional participation and quality of life. This can result in a narrow focus that does not adequately address the multifaceted needs of a child with a disability and may not align with the advanced practice expectations of a PCS specialist. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient-centered care, evidence-based practice, and ethical considerations. This involves 1. Conducting a thorough, individualized assessment to identify functional deficits and strengths. 2. Collaborating with the child and family to understand their goals and values. 3. Developing a treatment plan that is evidence-based, addresses identified needs, and aligns with the therapist's scope of practice and specialized expertise. 4. Communicating clearly and empathetically with the family, explaining the rationale for recommended interventions and addressing any concerns. 5. Continuously re-evaluating the child's progress and adjusting the plan as needed, maintaining a focus on the child's best interests and functional outcomes. Question 20. Compliance review shows that a 5-year-old child with a history of bronchopulmonary dysplasia presents with decreased endurance for play activities, frequent shallow breathing during exertion, and occasional audible wheezing. The child currently uses a standard wheelchair for mobility and has a metered dose inhaler for occasional use. The physical therapist is considering several intervention strategies. Which of the following strategies best reflects a comprehensive and evidence-based approach to address the child's needs? Option A. Recommend a series of breathing exercises that focus solely on deep breathing without integrating them into a broader exercise regimen or considering the impact on functional mobility. Option B. Initiate a gross motor skills program aimed at improving running and jumping, assuming that increased overall physical activity will naturally improve respiratory capacity. Option C. Implement a progressive exercise program focusing on strengthening inspiratory and expiratory muscles, improving diaphragmatic excursion, and incorporating airway clearance techniques, while simultaneously evaluating the current wheelchair for potential modifications or alternative adaptive equipment that better supports respiratory function during activity. Option D. Prescribe a new, more advanced adaptive seating system for the wheelchair, without a detailed assessment of the child's current respiratory mechanics or the effectiveness of existing equipment. The correct answer is C. Implement a progressive exercise program focusing on strengthening inspiratory and expiratory muscles, improving diaphragmatic excursion, and incorporating airway clearance techniques, while simultaneously evaluating the current wheelchair for potential modifications or alternative adaptive equipment that better supports respiratory function during activity. Explanation. This scenario presents a professional challenge due to the need to balance the child's immediate functional needs with long-term developmental goals, while adhering to the specific scope of practice and ethical guidelines for pediatric physical therapy as defined by the American Physical Therapy Association (APTA) and relevant state practice acts. The challenge lies in selecting the most appropriate intervention from a range of possibilities, each with potential benefits and drawbacks, and ensuring the chosen approach aligns with evidence-based practice and patient-centered care. The correct approach involves a comprehensive assessment of the child's respiratory function, including objective measures of breathing patterns, muscle strength, and endurance, alongside an evaluation of their current adaptive equipment. This is followed by the implementation of a tailored exercise program that specifically targets the identified respiratory impairments, such as strengthening inspiratory and expiratory muscles, improving diaphragmatic excursion, and enhancing airway clearance techniques. The adaptive equipment is then reviewed and potentially modified or replaced to optimize its effectiveness in supporting the child's respiratory and overall functional goals, ensuring it complements the exercise intervention. This approach is justified by the APTA standards of practice for physical therapy, which emphasize the importance of thorough evaluation, individualized treatment planning, and the use of evidence-based interventions. Furthermore, ethical principles of beneficence and non-maleficence mandate that interventions be chosen to maximize benefit and minimize harm, which is achieved through a systematic and evidence-informed process. An incorrect approach would be to solely focus on improving gross motor skills without directly addressing the underlying respiratory limitations that may be hindering participation and endurance. This fails to meet the comprehensive needs of the child and may lead to suboptimal outcomes or even exacerbate respiratory issues due to increased exertion without adequate support. Another incorrect approach would be to prescribe new adaptive equipment without a thorough assessment of the child's current respiratory status and the effectiveness of existing equipment, potentially leading to an unnecessary financial burden and a device that does not adequately address the child's specific needs. A third incorrect approach would be to implement a generic exercise program without considering the child's specific respiratory impairments and their impact on functional mobility, which lacks the individualized and targeted nature required for effective pediatric physical therapy. These approaches violate the principle of providing skilled physical therapy services that are tailored to the individual patient's needs and are supported by evidence. Professional decision-making in such situations requires a systematic process that begins with a thorough patient evaluation, including a detailed history, physical examination, and functional assessment. This is followed by the identification of impairments and functional limitations, the establishment of measurable goals, and the development of an individualized treatment plan. The plan should incorporate evidence-based interventions, consider the child's developmental stage and family context, and include ongoing reassessment to monitor progress and make necessary adjustments. Adherence to the APTA Code of Ethics and Standards of Practice, as well as state licensure laws, ensures that interventions are safe, effective, and ethically sound.